The chair for our next panel is Chris Finley. She is part of USC. She teaches at the Department for American Studies and Ethnicity, and she is from the Colville Confederated Tribes. And I hand over to Chris.
Hello, everybody. Welcome. So for our first paper, we have two presenters, as far as I know. So I guess we'll find out if I'm incorrect about this. So the first paper is Angela Mashford Pringle, Algonquin Temiskaming, and yeah, please correct me when you get up here. That'll be good. First Nation, and they're from the University of Toronto, Canada, in public health. And the other presenter is Tenzin Butsang from the University of Toronto, Canada, Public Health, Social and Behavioral Sciences. So the name of their paper is Kijibashik, Turn It Around, Colonial Violence and Previously Incarcerated Indigenous Mothers. All right.
Hi, everyone. My name is Tenzin Butsang, and thank you very much for having me here to speak with you about our project Kijibashik. Kijibashik means turn it around in Algonquin, which is the language of my supervisor and lead on this project, Dr. Angela Mashford Pringle, who is Algonquin from Temiskaming First Nation in southwestern Quebec. Angela unfortunately wasn't able to be here today for health reasons, but I'm grateful to be here to share this project with you and look forward to engaging in some good discussion. So I am a Tibetan settler born on the unceded lands of the Coast Salish people on the west coast of British Columbia, Canada, and I now live, work, and learn on the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee peoples in what is now called Toronto, Ontario, which is where this project is situated. So I'll begin with a brief review of kind of, the literature with some context I'm sure you're all well aware of, but is an integral piece of why this project exists. So this graph depicts the increase of Indigenous women in Canada's federal prison systems over the last decade, while the number of non-Indigenous women continues to decrease. And despite making up only 4% of the general population, Indigenous women make up over half of the women incarcerated in federal prisons. In addition to federal prisons in Canada, there are also provincially run jails that do not collect data on race or ethnicity. And so that situation is a little bit more opaque, but we know that the data follows a similar trend, if not more pronounced. And despite repeated calls from Indigenous communities, activists, and advocates, the number of Indigenous women in our federal prison system are the fastest growing segment of that population. And so, what do we know about the experiences of these women in terms of the academic literature? Not much. We know that people in prison experience poorer health and that these disparities exist upon release. We know that they encounter substantial barriers to health and well-being in both prison and in the community, including experiencing discrimination and ongoing racism. We know that women face heightened challenges associated with higher rates of traumatic histories, experiences of violence, self-harming behavior, and substance use disorder than men. And we know that a large majority of these women are also single mothers, and so often child welfare agencies are involved, and we know that the consequences of forcible child removal are associated with the detrimental health and social outcomes for both mother and child across the lifespan, from social exclusion and poverty to mortality. So this project really approaches the mass incarceration of Indigenous people, and specifically Indigenous women, as a public health issue, not just because of its negative impacts and relationship with key markers of health, which is significant, but for its generational and community impacts. So for Indigenous women with experiences of incarceration, the physical, emotional, mental, and spiritual dimensions of health have been identified as distinctly and differentially influenced by their identities as Indigenous women, mothers, and formerly imprisoned people. But we know little about what those impacts actually are upon release, especially for mothers. So now I'm just going to tell you a bit about the project and how we've done it and how it's been going. And here, the importance of collaboration with our community partners on this project can't be overstated. It's been a community effort from the ground up. We have 5 main community partners on this project: Thunder Women Healing Lodge, Native Women's Society, Elizabeth Fry Toronto, Aboriginal Legal, and Pasan, and some of whom we've been working on this project with since it was just an idea back in 2018. At the time, we knew that the numbers of women in prisons were continuously going up, and we initially reached out to several partners we had already had relationships with to ask if there was anything we could do to support their work with Indigenous women involved in the criminal justice system. They told us that they told us what they were seeing in communities, and essentially about the harms of incarceration and the child welfare system and the lack of support for women, both when they were released and prior to incarceration. And they knew that what was needed, and they could see the impacts in the community and among the women they served. But we have this hierarchy of knowledge that extends to the funding bodies, and the partners wanted something that they could really take directly to these funders to get the resources they need to provide the support. So with our partners, we developed a few questions to kind of guide the research. The first being, what is the impact of incarceration on the health and well-being of Indigenous mothers? Here we have the medicine wheel in terms of the mental, spiritual, emotional, and physical elements. How do Indigenous concepts of gender and motherhood interact with Western biological notions of being a mother, and how does this influence the programs, policies, and services currently in place for incarcerated Indigenous women? Here, the question centering around this notion that motherhood is just not just limited to its biological definition. And finally, what are the unique needs of Indigenous mothers in the criminal justice system? Just a note on this photo, this is an artist mock-up of what Ontario's first community-run healing lodge will look like, which is being led by one of our community partners on this project, Thunder Women Healing Lodge Society. So in terms of the logistics of this project, it was interviews we've been conducting in Toronto with previously incarcerated self-identifying Indigenous moms, mother figures, and Two-Spirit parents who were parents prior to incarceration or became parents during incarceration. And also, in terms of just a small token of appreciation for them sharing their time and their stories, we provided a $50 honorarium for each participant. Recruitment was through our community partners as well as through our participants. We created posters and pamphlets and ran a little social media campaign. And we used a narrative and storytelling approach where our sources of data were one-on-one interviews that were about an hour to an hour and a half long. And the nature of the interviews, being very personal, and the fact that the women were telling us things that have often been very traumatic for them and their families, it was incredibly important for us to have the appropriate care for them throughout the process of the project, both during the interviews and after. And so through our community partners, we were able to offer them access to healers, elders, and knowledge keepers. Some of the interviews actually happened on site at our community partner offices where they could speak to anyone they would want to speak to directly. And we also have one of our research assistants on the project is a trained victims' rights advocate and who also has training in trauma-informed counseling. And so participants were able to debrief with her as well after the interviews if they requested to. OCAP, the principles of ownership, control, access, and possession, which may be familiar to some of you who work with First Nations communities and do research, were established in 1988 to address community harms from research. And although we were not working with a specific First Nation for this project, but an urban kind of Indigenous community, an urban Indigenous setting, we wanted to still ensure that we met these principles to the best of our abilities, and we created partnership agreements and data sharing and data governance protocols with our community partners based on the principles of OCAP. And finally, the data analysis, which I'll kind of explain a little bit further, but is kind of an ongoing process at the moment. We completed, we will be conducting a thematic analysis guided by the Medicine Wheel framework. But we so far have completed the first phase of interviews, which is with 20 women, and we're currently in the second phase of interviewing for this project. But I'll be presenting some of the preliminary findings from the first phase of our interviews with these 20 mothers. So these are just some of the findings on the context of incarceration for the participants in our project. Level of involvement in the criminal justice system really varied with each participant, from a single experience, of a couple nights in jail, to more than 10, and, several instances of being incarcerated in jail or in federal prison. Intergenerational trauma and parental contact with the criminal justice system were really salient issues for many of the women. Participants had parents who were, either subjected to the residential school system or the 60s scoop. And participants often described experiencing sexual assault and domestic violence in their childhoods or as adults. And so kind of framing the conversations and stories that we're hearing from some of the participants in terms of parenthood while in prison, several participants really described significant emotional and mental health impacts of giving birth while in prison. One mother recalled, being kept in handcuffs while at the hospital in labor, and other participants, one mother had all 6 of her children apprehended at birth, which is a really staggering kind of story. And this is all through this process of birth alerts, which is something that happens in Ontario hospitals and Canadian hospitals, where social workers or hospital staff may flag an expecting parent, often without their knowledge, as being unfit to care for the child that they are carrying. The result is newborn babies being taken from their mother's arms, sometimes shortly after birth. And Indigenous parents are significantly overrepresented in cases where birth alerts are issued, for many of the same reasons that we see the mass incarceration of Indigenous people now in Canada, including racism, discrimination, and settler colonial legacy. Almost all participants experessed some distrust of the criminal justice system and its agents, including police and correctional workers. Here there's a quote from one of our participants who described being treated as less than human, and she describes race and her being as an Indigenous woman as a driving factor, resulting in the inequitable treatment she received when her child was taken away from her when she gave birth while incarcerated. Similarly staggering was that all participants really described involvement with the child welfare system, either with their children and with their grandchildren, or as children themselves. Here a participant described the sense of hopelessness that was commonly expressed by many of the participants when their children were taken away. So like this participant, many described how there was, how they often felt like there was no recourse, and they had limited resources and opportunity to prove themselves as fit parents, which is really what the system demands of them. And poverty was often a recurring factor described by many of the participants with child welfare involvement. Participants also described this, the impact of incarceration on their mental health, not only as individuals, but as parents. So they described, feeling isolated and having no support, but also emerging from prison with mental health issues as a result of their, not only their treatment while incarcerated, but from being separated by their families, thinking, separated from their children, having their children taken away from them. And they clearly identified these experiences as not helping them, not supporting them in being able to become better parents when they were released. So in terms of culturally relevant programming in prisons and jails, among the participants who did participate, some, felt that they were only, as an Indigenous person, that they were only kind of invited or offered to participate in Indigenous programming. And so we heard from participants who would say, if as an Indigenous person, as an Indigenous woman, if you don't actually access any of the services that they're providing you as an Indigenous person, you really don't have access to any services. And so further to that, some expressed frustration at not having access to any cultural programming. Some didn't feel that the programs were helpful. But high school courses and church services were the two programs most attended by participants. And overall, participants expressed the need for both Indigenous cultural programming, as well as substance use treatment and parenting programming. An important thing to note that I might get to in the questions later, but Canadian prisons and jails offer very different experiences in terms of programs. And, in terms of the jails, there's a lot less programs available for women who are incarcerated due to the nature of it being 2 years less a day versus federal programs are often 2 years or longer. The participants often described complicated relationships with their children, many of whom were now adults with their own experiences with substance use and incarceration and child apprehension. And while many participants described the painful experiences of having their children placed in the care of others, some also shared this sense of relief that their children did not have to directly witness their issues with substance use. So, some women expressed that jail had been something they needed to get them on track, or using jail as detox, which speaks a lot about the failures of the systems, the social systems that we have in place, that women felt that they needed jail to kind of be able to get back onto a path that they wanted, or be able to be a better parent. And several participants also described how rebuilding relationships with their children, were really purpose-giving experiences after they were released. And some even described how becoming caregivers to their grandchildren had renewed this sense of purpose. And so, there's a lot of hope there too, as well, amongst, a lot of sad stories. So in terms of next steps, this research was really tailored to the needs of the community. And so similarly, our kind of knowledge dissemination and knowledge translation approach is involving community at all stages. And so we will be using, our findings and generating input and feedback from the community on them, and kind of really involving them in terms of how do we implement this change? How do we actually get this information to the people who make the decisions to ensure that policies are in place to reduce the incarceration of Indigenous people and Indigenous women in Canada. And so one of the things, a few of the things that, the main areas that we'd like to address are the ongoing racism and discrimination in correctional settings and upon release, the need to amplify the voices of Indigenous women and Two-Spirit people with experiences of incarceration and providing opportunities for them to share their stories, and specifically more opportunities for parents to build and maintain relationships with their children during incarceration and upon release. We heard so many stories from women whose children were taken out of their care. They were released, their children were still in care, and they were expected to go travel several hours to get to weekly visits with their children, often with very limited resources. They had to find a way to get there on their own. And, if you know the Greater Toronto area, once you are outside of kind of like the downtown core, public transportation is really difficult. And so, it was a very challenging experience for many of the women we spoke to. There's also a huge need for coordinated responses from social service, housing, substance use treatment, and mental health agencies. One of the things that we often spoke about with participants were the need for decriminalization of drugs and improved access and quality of trauma-informed substance use treatment and mental health care. Another really salient issue was decarceration with comprehensive reentry plans. So during COVID-19, we saw a huge release of a number of women and people from prisons, and this kind of exacerbated this issue of unsafe release that we were seeing prior to COVID, but with the large numbers happening during COVID, the challenges were just even more prevalent in terms of people being released in the night, people being released without transportation, with no money, no cell phone, community agencies who weren't informed that their clients were being released at all, or the dates being changed at the last minute, and no communication happening from the jails to the community partners. And so that's kind of been a huge focus of this project, and in kind of the next projects we've been undertaking with our community partners that we really have been developing and are hoping to kind of address really head on, and really highlight that this relationship with incarceration, child welfare, and release, unsafe release, is really linked with this, with the missing and murdered Indigenous women and girls crisis that we're seeing all around Turtle Island. But we're hoping to kind of continue to work with our partners to be able to address those challenges and the injustices. And so that's kind of where we're at now. And just some thanks to a few folks, and thank you for listening.
Thanks for the presentation. My question is around Section 81 healing lodges, and I'm wondering if any of the people that you interviewed were implicated in healing lodges versus federal corrections or provincial corrections, and if so, to what extent did their kind of experiences vary in the context of a healing lodge versus a traditional institution?
Yeah, so that's a great question. So we had several participants who were from, actually one of our community partners is a community-based healing lodge, Thunder Women Healing Lodge. They currently have about 7 beds at their lodge. And so we spoke to women who were there and did interviews with them there. And so we only spoke to women who were at healing lodges that were run by community, not by the Corrections Canada. So there are, just for some context, there are a few healing lodges that are run by the government under the Correctional Service Canada. And then there are a little handful that are run by community-based organizations and that are really done with community care and consultation. And so Thunder Women is the only one in Ontario, and we were able to speak to women there.
Just sparked a question for me. I know that in the US, sometimes these kind of culturally informed workshops or centers that are within prisons are restricted to Native prisoners, and that can lead to questions about who's Native enough to access these programs. And I wonder if that's something that came up in your fieldwork.
Yeah, that's a great question. And, there's been some stories that were more publicized in Canada for that reason, with non-Native folks being admitted into, non-Native women being admitted into healing lodges that were run by Correctional Service Canada. That specific issue didn't come up in our interviews, but there was a lot of discussion around what does it mean to have culturally informed programming. And I think I briefly mentioned it, but there were a lot of women who mentioned, kind of highlighted a lot of tension between wanting to access the services they needed and then also having to identify as Indigenous in order to get those services. And that was one of the challenges that were raised by a lot of the participants, who also sometimes felt that we have, so in Ontario, we have some Native child welfare agencies who are essentially part of the same system of child welfare run by the government, but are kind of these more culturally informed child welfare agencies. And so while there were participants who expressed gratitude for that and who felt like they were being adequately served through those programs, through that culturally informed service and agencies, there were others who felt that that process still didn't serve them, and that they were still removing their children, and that they were still essentially different arms of the government who were separating them from their children and separating their families. So yeah, I think that's a really really pressing issue that a lot of the women were discussing in kind of different ways around identity and access to services and care and programming. So yeah.
Thank you for your presentation, and I think your research is really important to give voice to those women that are in that are in prison right now. I'm just wondering if the particular institution that you're doing research on, if they have access to the Walls to Bridges program, which is a federal program where they take the university classroom into the prison. And my second question is kind of related because I'm teaching in that program right now. So I go into a federal penitentiary for men, and I teach about the history of linguicide in Canada, so the destruction of Indigenous languages. And what we found in going into the classroom was that a lot of the men that are in the federal penitentiary are language speakers. And so what we're trying to do is give those men some teaching skills so that they can either teach the language in the prison or teach the language when they leave to go, like when they go into the community. And they had no idea that they had such an asset because there's so few speakers around. Yeah. That a lot of them now, it's giving them a bit of hope, and also some of them have said it's like a calling. That's what they want to do now. So I'm just wondering, A, is the program reaching this institution, the Walls to Bridges? And then B, have you noticed if there's any language speakers, or did that come up at all in the interview?
Yeah, thank you for the question. And so we interviewed recently released women. So we weren't set at any particular institution, but we were just through our kind of community partners who were accessing and participants who were accessing services there. That's how we kind of reached participants. None of them specifically mentioned the Walls to Bridges program. Many of them mentioned school, like completing a GED, or doing the school program, doing a school program, but not the Walls to Bridges specifically. And something that has come up in interviews is around kind of loss of culture and not being familiar with culture or language. We had several participants who kind of mentioned that they're they learned later in life that their parents were involved, that their parents were taken to a residential schools, or experienced harms at a residential school, and that there was kind of limited communication about that, and so that they also that they also didn't have anyone in their families to really teach them language, or to learn language or cultural traditions from. But they also often expressed a lot of interest in learning. Actually, it was interesting that we had 2 participants who were really also interested in becoming social workers and addictions workers because of their experiences, but also to kind of be able to bring change to that workforce and that profession. But yeah, and many participated in kind of, they would mention they participated in drumming circles and things like that, but yeah, not as much about language. Yeah.
Thank you so much. I wanted to know a little bit more about the culturally relevant programming. So you mentioned that Indigenous women, Two-Spirit people, transgender people were advocating for more of those services, and I'm curious to know how they envisioned culturally programming. If they perhaps talked about how they wanted Indigenous psychologists or social workers who have knowledge of the Indigenous medicine wheel to be people that they can go to and talk to, or if I think those other questions about language and the sweat lodge are also important, things to include as part of the idea of recovering, of getting better, or also notions of restorative justice. I'm just curious to know if there's kind of, some implications or some discussion of what that might have meant.
Yeah, thanks for that question. One of the things that I remember coming through in a lot of the interviews was for the women who did participate in programs, it was often for the first time. And, they expressed a lot of just being able to kind of the fulfillment of being able to learn about 7 grandfather teachings for the first time, or beading, learning to bead for the first time, participating in drumming circle. And so those were the kind of more culturally based programs that were discussed a lot. In terms of parenting as well, they wanted more culturally relevant parenting programs. And so that were based around the teachings that they either grew up with or came to know later on in life. And also to be able to have a further connection with land. And, when I was in my undergrad, I used to volunteer at as a school tutor at a youth detention facility there in BC. And one of the things that they did was do gardening programs with the youth. And so there would, be around teachings around planting corn and things like that. And so it's a variety of when we say culturally relevant programming, there's a broad spectrum. I think some of the most pressing issues were around substance use treatment and access to what's called a NILO in Ontario, which is like a Native liaison officer essentially for Indigenous people in prison. And for a lot of people, for a lot of the women, that NILO officer was kind of their main point of contact in terms of being able to get culturally relevant services or programming, even, and kind of to begin some discharge planning. But a lot of them expressed how it was so difficult to often get in touch with their NILO officer. There's often like the number of NILO officers to however many people are in the prison is very small. And so they would often not be able to get to see the NILO officer that they wanted to see in time, or even when we're talking about healthcare, like healthcare in prisons is and especially in jails, are just severely underserved. And so, you know, not being able to access the counselor who would only come, you know, once, who's in the prison for one day a week. And, you know, so like further to like, you know, cultural programs, being able to access those basic healthcare needs and the kind of those point people that would be able to get them in contact with the people that they need to be in touch with to access those services once they were released were really discussed amongst a lot of the participants.
I'm going to sneak a last question from the back. You mentioned some of the very difficult circumstances of reunification after women were released, but I would love a clearer sense of what kind of access do they have to their families while they're still incarcerated? Is it similar to the US system where people are charged exorbitant rates even to call their families? Like, what are some of the barriers while people are still incarcerated? Thank you for the presentation.
Thanks. Yeah, a lot of similarities there in terms of very limited communication. One of the main things that kind of came up is that a lot of women are often, and for Indigenous women who live in rural communities, if they're incarcerated and they're incarcerated in a prison or a jail that's far from their home community, the only way that they're going to be able to see their family is if their family is able to pay to take that flight or take the train or bus to come however many hours to see them in person. And so that is a challenge on top of all the other challenges that people in prison have daily in terms of communication with families. And then on top of that, there's also when children are apprehended by the child welfare system, you know, sometimes there's kinship agreements, and so sometimes they're placed with family, but there are also cases where they're placed in foster care. And so there's several women who often expressed how it was difficult to get the child welfare workers to commit and be bringing their children or calling them at the arranged time every week to be able to see their children and maintain and foster those connections with them.